Hello, everyone. Welcome. We're just going to wait a minute while everyone starts to join the webinar, and then we'll get started. All right, we're at noon, so I will get us started. Thank you for joining us today for today's webinar, Building a Dementia Capable Community. We'd like to begin with a land acknowledgement of where this webinar is being hosted from. The Schlegel-UW Research Institute for Aging, or the RIA, acknowledges that we are on the traditional territory of the Attawandaron, Anishinaabe, and Haudenosaunee people. The RIA is situated on the Holdeman Tract, the land promised to the Six Nations that includes 6 miles on each side of the Grand River. I know that many people are located in different places, so feel free to silently do your own land acknowledgement on the space that you are currently in. Before I introduce our speakers, I'd like to cover a few housekeeping topics. So today's webinar is being recorded. We will be sharing the link with you by email after the event is complete. We welcome you to visit the content yourself and share it with your colleagues as well. The slide deck, however, will not be shared afterwards. We also invite your comments and questions. So please take a look at the Q&A or question and answer chat box on your Zoom panel. If you think of a question for the speakers at any point, just type it in there. We will do our best to answer the question during the discussion portion at the end of the webinar. If there are too many questions to reply to today, we will write out answers to the questions and send them out by email to registered participants in the next few weeks. We will be using the built-in Zoom polls feature in this webinar. So I'm going to launch a poll question right now so that we know the various identities of those who are joining us today. So when a poll is launched, a window will automatically pop up on your screen with a question or a series of questions. Simply select your answer or answers and click submit. The results are completely anonymous, so please feel free to answer honestly. So I will now launch the poll question and give you a moment to submit your response. So the question is, which of the following do you identify with? And you can select more than one of the answers. So the poll has been launched, and I'll just give you a few moments to fill that in. Just give you another few moments for those final entries. Okay, I'm going to end the poll and quickly show you that we have a variety of individuals here today that identify in various ways. So you were able to click more than once, so that's great. Thank you so much for sharing and for your time in that. Okay, so we're also going to launch another poll similar to that near the end of the webinar, just to get an idea of your experience with the webinar today. So stay tuned for that. So we will begin with the webinar with a brief presentation about the Building a Dementia Capable Community project from Laura, Samantha, and Rachel, and then we will move into a panel discussion with Kathleen and Jim. So now I'm going to pass it along to Laura first.
Thank you so much for taking the time out of your day to join us for this webinar, everyone. It has really been a pleasure over the last few years to work with those on the webinar, but also so many different members of our community on this project. My name's Laura Middleton. As Carrie said, I work at the University of the Waterloo and Schlegel Research Institute for Aging and work together on these large teams on our Dementia Capable Community project. So I will start with talking about why this project is needed. And hopefully, I'm sure this is preaching to the choir here, where you're attending this probably because you believe in the importance. But contextually, we know that it is more and more important to really consider the needs of people living with dementia. The Alzheimer's Society of Canada's landmark study estimated that there are about 600,000 people living with uh, in Canada as of a few years ago. That probably is up to about 750,000 in Canada now. Like many age-associated conditions, we expect that number to increase dramatically over the next 30 years, reaching numbers over 1.5 million people by 2050. Now, I always say I don't say this to set off alarm bells about the impending doom, but to spark a drive to prepare ourselves to evolve our programs and services so that we can better support and include people living with dementia, respecting them as people and as members of our community. And this need to prepare isn't only a nice to do. Being included and supported is a fundamental right of people living with dementia, as outlined in the UN Convention on the Rights of Persons with Disability, which includes people living with dementia as rights holders. The UNCRPD went into force in 2008, and people living with dementia were formally acknowledged as right holders in 2016. Among other rights, the UNCRPD guarantees the rights of people living with dementia to respect for dignity and autonomy, non-discrimination, respect for differences and acceptance in their communities, full participation and inclusion in society, and accessibility. Nationally, the Accessible Canada Act was enacted in 2019, and the goal was to ensure that Canada met its commitments under the UNCRPD with a goal of a barrier-free Canada by 2040. That same year, Canada launched its first national dementia strategy. Within this strategy, they outlined the current status and aspirations in a number of different areas. Directly related to our project, they identified that there is currently widespread stigma of dementia and a lack of understanding of the condition. The aspiration is to reverse this, that people understand dementia and no longer hold stigma. And so inherently, why does this project matter? Well, experiences of stigma and exclusion remain common in our communities and influences how people living with dementia can participate. To truly move from stigma and exclusion to inclusion and participation, we need action on all levels of our community, from the knowledge and experiences of community members to policies and plans that influence how our communities are built and run. These actions are likely to be different depending on our community and neighborhood, especially across urban, suburban, and rural neighborhoods. We thought that was really important to understand these differences in our project. So our project objectives are considering these differences to identify barriers and supports to inclusion in each community for people living with dementia, to envision what a dementia capable community could look like, and to co-create, so work together to create actions and tools that will allow a dementia capable community to be built. So next, I'll briefly talk about how we work together because that's really inherent to our project. We used what is called a participatory action research approach. That means we involved all the people who will be affected by our project in all levels of our work, from strategic planning and bringing together the project to deciding how we share information about the project at the end. In particular, we involve people living with dementia, including Jim and Kathleen, who speak with us today, but also care partners, community organization, public services, municipal staff, and other community members to help envision a dementia capable community and identify the actions needed. In all levels of our project, our teams were governed by principles and enablers of authentic partnership. These principles and enablers were developed over a decade of participatory research by Sherry Dupuis and colleagues affiliated with the Murray Alzheimer Research and Education Program. In brief, the authentic partnership approach requires creation of a safe space by respecting and valuing the diverse perspectives of all members of your team, creating relationships that allow you to reflect and communicate openly to forward work together towards our shared aims. And so in this particular project, we had multiple participatory action research teams. We had a national research team, both Kathleen and Jim, Rachel and Sam and I were members, steering teams for each neighborhood type, and also an advisory team of people living with dementia. Our national research team included people living with dementia and care partners, representatives from municipalities and the Alzheimer's Society, as well as researchers from multiple disciplines. This team specifically provided strategic oversights for all phases of the project and also how we engaged with other teams. Together, we chose to focus our work in the region of Waterloo as a start and then selected specific neighborhoods that had diverse populations and a sizable group of older adults. We reflected on and made decisions together and based on what other teams told us, including in relation to our project tools that came out. The local steering teams also had people living with dementia and care partners, but also had a broad range of community members involved. So they include healthcare professionals, community centers, recreation, planners, community members, and more. Each team was facilitated by a research staff member, but really driven by our community members. The teams focused on local interests in relation to their neighborhood and their neighborhood type, identifying unique barriers and supports as operated in their communities. We were also really lucky to have the advisory, have people from the young onset dementia group advise on our project. We had 2 meetings with them. The first reviewed how we were going to engage with people living with dementia in the community to make sure that our processes were comfortable for them, as well as documents that we'd use to share with them. They also talked about different barriers and facilitators they face to inclusion in various settings. We also did this with the steering teams. Now, later in our project, our local steering teams decided they really wanted to share information across. They wanted to talk about the differences across different community members. So we went from those 3 different teams to combining them as one united steering teams where we could talk about the differences faced by urban, suburban, and urban communities. So thank you very much, everyone. I'm going to now hand it over to Rachel, who will talk about understanding the barriers and supports needed by people living with dementia in our communities.
Thank you so much, Laura. I'm happy to be joining the call today from Concordia University, where I'm an assistant professor in the Department of Political Science. And so today I'll be sharing a little bit about how we worked together on our team to understand the lived experiences of people living with dementia and their care partners in the region of Waterloo. And in particular, how we set out to understand the barriers and supports needed to living with dementia in Waterloo. So, we started this phase of the study by conducting what we are calling go along interviews. And these are essentially qualitative interviews where we move through an outdoor space or environment and ask people about the world around them as we're moving. So, unlike most traditional interviews where we might be sitting together at a table, these interviews allow us to move through a neighborhood or maybe even a park and get a feel for how aspects of the space are experienced by people living with dementia. So, we conducted these interviews with 7 people living with dementia and 3 care partners, all of whom live in different parts of the region of Waterloo. Now, all of these participants were interviewed across multiple sessions, usually one interview, kind of a session at home to get started and introduce ourselves, and then one of these go along interviews in a location or a park or a part of the neighborhood chosen by the participant. We then gathered up all this data together and anonymized it so that we could begin our analysis. Next slide, please. So from here, we hosted a series of meetings with our action teams and recruited a group of people to be involved in the data analysis with us, the research team members. In most research, we as researchers would collect and analyze the data. But in this particular case, we wanted to actually involve community members in this process of analysis alongside us and help to inform the analysis as it was taking place. And so that's why we undertook what we call a participatory data analysis process, which means that traditional non-academic partners or community members, lived experts, are involved in the analysis process, which was really fantastic. So I'm going to share a bit more about that now. Next slide, please. Now, the process itself involved a few different steps. After forming the team and figuring out who among our community members would participate, we hosted a series of Zoom calls to get the analysis started. And ahead of time, I had worked through all of the interview transcripts and selected a few dozen quotes, big quotes, like the one on the screen here, that really reflected some of the different elements of the interviews that we did. Then, on these different Zoom calls, we taught the group some of the basics of how to actually interpret qualitative data. So, how to identify what we as researchers call codes and eventually themes in the words that people used in their interviews. So, here on the left of the screen, you can see an example of a quote that we highlighted with some different colors to represent the different ideas and maybe preliminary themes that we saw in the interviews. And importantly, we as researchers did not do this alone. We went through this whole process as a team with community members and lived experts. And then to really bring it all together and to develop the big themes or big ideas from the interviews, we brought everyone together in person. And so here's a photo of me on the right side, standing next to some easels with sticky notes. And we had a lot of fun that day, kind of pulling together our different ideas to build out the themes and the findings from these interviews. Next slide, please. And so as a group, we ended up building 4 themes in the data. And these themes basically represent the big ideas that came up over and over again in these different go along interviews that we conducted with people living with dementia and their care partners. And so, to kind of give you a sense of what we found and what these themes mean, I'm going to read a different example quote from each of these themes. Next slide, please. So, throughout the go along interviews, participants described an overall goal of wanting to feel well, to feel safe and comfortable and attached in their communities. And this goal was described in relation to their homes and private spaces, but also community spaces and neighborhoods. When asked about how a dementia-capable community might look or feel, participants described wanting to feel a sense of place attachment, to feel included and feel at home in their communities. I mean, these are things I think we all want. These desires were contrasted with negative emotional responses, such as panic or discomfort, feeling burdensome, that they explicitly did not want to feel as people living with dementia. But one participant described positive feelings linked to the natural environment when they said, "This walking trail makes me feel happy. It's so darn nice to get out of that apartment and do something. Out in the fresh air, the trail is always well maintained." And their care partner, who was in the interview with them, responded by saying, "Yeah, they groom it and make it nice and level." And the person living with dementia said, "And those stones, if you've been walking and you're tired, you can sit on the stones for a while and have a rest. They're perfectly comfortable to sit on. They're not bumpy. The tops are smooth. It's perfect." Next slide, please. Our second major theme related to getting around, things like transportation and mobility. Throughout the Go Along interviews, participants, including people living with dementia and care partners, highlighted many different barriers and facilitators to feeling supported in their dementia journey. For example, participants highlighted the different tensions that can come up between appreciating car rides from friends and family members when they need to go out, but also not wanting to feel reliant or burdensome on those supports when their friends and family are offering to give them a lift. Participants also mentioned that getting around in their community is very much tied to things like familiarity and routine, especially for folks living with dementia. One participant stated, "I go for a walk every day, 7 days a week, to the grocery store or the drugstore. It's about a 45-minute trip. One way for me because I got to stop and sit down and catch my wind. But I do what I can. I only go where I know where I'm going. If I don't know where I'm going, I don't bother going." Next slide, please. Thank you. Participants also highlighted many facilitators, but also challenges in their communities linked to social connections, neighbors, and different community groups. Participants felt that supports from informal social ties went a long way to promoting a sense of inclusion and safety. One care partner in particular found that their next door neighbors played a really key role in helping them to feel supported and connected to their broader community. They said, "I'm happy because our neighbors will sometimes come over if I'm not here. I'll ask them and they'll come over and make sure my partner's okay. And if she doesn't have supper, one of them will make her something. At this point in my wife's dementia path, I wouldn't want to move to another place. She knows this place inside and out. She's comfortable. She's happy. No problem." Next slide, please. Lastly, we constructed a theme that we called fluctuation to capture the barriers, facilitators, and complexities of dementia that ebb, flow, and fluctuate with time. The nature of dementia is such that each week, each day, and even each hour is a little different. Needs, desires, and strengths can fluctuate. For many participants with dementia, they felt that their fluctuating needs and strengths were not necessarily accounted for in the community, in urban planning, or in services available to them. And so they highlighted a real need for service delivery and built environments that are better able to fluctuate with them and their changing needs. One participant describes a frustrating experience of not being able to enter one of his longtime favorite restaurants following changes to his mobility. He said, "There's a restaurant where I used to get into before I had my walker, and then all of a sudden I get my walker and I can't go in anymore. There's no ramp and there's a lip to get in. If they ever put a ramp there, I might go in and have breakfast." Next slide, please. So as you can see, the process was fantastic. It was rich And it really helped us to solidify what we need to do as a community in the region of Waterloo to better support people living with dementia. Now, these are just a small sampling of our findings, but they really helped us to inform this toolkit that we've developed and also build important capacity across our network. The process was also just really fun. We had a great time working together across academic, community, and lived experience partners, and we're really proud of what we've accomplished together so far. So now I'll pass the screen over to Samantha, who will carry us on from here.
Thanks, Rachel. Hi, everyone. I'm Samantha Viglieri. I'm a professor of urban and regional planning at TMU, and I'm excited to tell you all about the tools that we co-created through this process. Tools that you as municipalities, community groups, workplaces, groups of friends can use immediately to make your community more dementia capable. As my colleagues have explained, this project was a huge interdisciplinary undertaking, and it involved so many steps, including drawing on evidence from our scoping review, recently published in the journal Dementia, insights from the PAR research meetings that Laura described, results from the go-along interviews that Rachel described, and finally, a series of all-day collaborative workshops over several months. Next slide. It was through these workshops with people living with dementia, care partners, municipal staff, businesses, community groups, healthcare professionals, it's a long list, emergency workers, religious leaders, and accessibility experts that we worked together to co-create this framework. Together, we looked at evidence globally and contextually from Waterloo, thinking about the differences between urban, suburban, and rural communities within the region. We thought through targeted areas of action, from how we interact with our neighbors and other community members, the programs people may attend, be it a day program, a rec program, or a hobby program, the places people may visit, like libraries and stores and banks, how people get around by car, by transit, as well as how the community is designed, so parks and streets and wayfinding, for instance. And then in a room of over 40 partners, we collaboratively decided on these items: a vision, values, strategic directions, targeted areas for action, and tools. Next slide. Our organizing document that you can access online is the action plan. Fundamentally, it's a resource for municipalities, community members, and groups seeking to better respect and support people living with dementia. It is a starting point for you to begin to develop your own local version. Importantly, this document contains detailed processes and tips for you on how to do this work. We explicitly outline how we did engagement, the types of techniques that we used, and basically everything you need to get started with this process. Next slide. Diving into our vision. So a vision is a future state that we wanted to see achieved, and together we wordsmithed this live. Our vision is communities where people living with dementia can participate and are valued, respected, safe, and feel a sense of belonging. We also developed a series of values, sometimes called principles, to guide the work of the action plan, things like belonging and interdependence, autonomy, and education, and they're further defined in the plan. Next slide. Further structuring the action plan are our strategic directions, decided upon as a team, again, trying to target different scales and areas of impact. Everything from having an active voice and role in decision and policymaking, to the design of community spaces, adapting of programs, having equitable access to transportation, impacting education and training, and of course, reducing stigma. Next slide. And here's where the nerdy part of me as a planner gets really excited, because we took all of these co-created actions and formatted them into policy language that municipalities could implement into existing systems. For instance, the direction about being involved in the decision-making process. We have these 3 tangible implementable actions that municipalities can undertake. The first one being requiring municipalities to engage with people living with dementia in all policy updates and collect data on who gets involved. Number two, conducting an accessibility audit of current practices and adapting accordingly. And three, encouraging people living with dementia to serve on provincially mandated accessibility advisory committees that advise council on matters. Next slide. Within the action plan, we also link to other tools that we made collectively to support the Dementia Capable Community process, and these tools go hand in hand. To start, we developed free learning modules to help people develop the knowledge and skills for supporting people living with dementia and creating a more inclusive community. This includes everyone, especially those who do not think that it is in their job description. Next slide. We also developed journey maps to help people understand barriers that people with dementia encounter in the community and actions they can do to support them. The maps are paired with a short discussion guide. The focus on the journey helps us to understand that it's not just about having access to a light rail transit stop, but it's about the quality of the sidewalk on the way to the stop. Was the snow cleared on that sidewalk? Is there a transit operator who's patient and kind and takes time? Is there an automatic door opener to the rec center? Is there somebody there to greet you when you get inside? It's all of these small actions that start to add up, and they require all of us in community to be a part of it. And also, a fun fact, through our grant, we also paid to have these journey maps in Grand River Transit vehicles in Waterloo region, meaning that folks all over Waterloo are seeing these journey maps. Next slide. And finally, and perhaps my most favorite tool, is the video that we developed with our co-researcher, Kathleen van der Linden, who we'll be hearing from shortly, along with Jim, and who is living with dementia. So based on our go-along interviews and conversations over the years, we worked with Kathleen and a professional production team to create a storyboard of everyday places and experiences for Kathleen in her neighborhood. We went out, we had this great filming day in all these locations, and we interviewed Kathleen. And similar to the journey maps, we pair the video with discussion questions. And for now, I want you to reflect on what stands out to you personally or in your professional role. And I'll say, roll the video, Laura.
Like, get up in the morning. It's really hard to try to remember because I have forgotten in the past. I go outside. I love the fact that there are trees everywhere. Hearing the children on the street, laughter, and they are so great. And I like all my neighbors that I know. There aren't enough benches. I think there should be more benches. It's really getting to be seeing the cars going every which way. The world's going so fast. I'm the type of person who needs to be around people. Being at the YMCA really makes me feel safe and secure. And I know people. When I go to a library, I say, what would you suggest? People do make a huge difference. Laurel Creek, it feels like home to me because I love to see all the butterflies and bugs. Look at me, I'm just like you. There's no shame. I've got dementia, and could you, if I need it, would you be around here to help me out?
Amazing. Now, every time I play that video for my urban planning students, it's this 2.5 minutes that changes their minds about design, about programming, and about the importance of human connection for all of us, and especially for people living with dementia. And I remain forever convinced that it is storytelling that changes minds. And with that, I want to introduce the star of our video, Kathleen Vanderlinden and Jim Mann, both co-researchers and members of our national team, and both of whom are living with dementia. Welcome to you both, and we can turn off the PowerPoint for now so we can see their faces. Okay, awesome. All right, so my first question is going to Kathleen. I want to ask you about the impact of the video that we just watched. You shared this video at your church. Can you tell us a little bit about how the video impacted people at church?
It was so terrific. They stood up and gave me a standing ovation, which I was really surprised at. And they have since it aired, the first Sunday after that, they got a room that's off the church and has a video playing, and it's a quiet space. It's self-centering, and it's for anybody could come in, but with respect, they have to be quiet. And that's been amazing. They love it.
Amazing. It sounds like you really got them thinking, and they made an immediate change, which is awesome.
Yeah.
Thank you. And Jim, my first question to you is, why do you think it's important to have people with lived experience on a research team like this? I think you are on mute, Jim. My apologies.
It's why
There
I have this to drink my water in. I think the importance of hearing in this particular instance what it's like to move around a neighborhood. Without hearing from that, those individuals, people wouldn't know or wouldn't understand, and that's part of it is understanding what some of the requests mean, why they're being asked, and I think back to articles that I've read where a person, perhaps in a wheelchair or with a walker, maybe will phone ahead and see if a particular restaurant or something is accessible. And they're told, oh, yes, we are. And then they get to the door and find that, no, you're really not. And it's that lack of perspective from the lived experience. And that's why it's so important to hear that.
Yeah.
Absolutely. I think that's a good segue into my next question for Kathleen. Thanks, Jim. And so, Kathleen, at one of the workshops that we had together, you had shared your experience with us about your experience using Mobility Plus, which is a paratransit service in the region. Can you tell us a bit about that experience and what changed after the workshop?
Yes. I went to sorry. Can you repeat that?
Yeah. You had shared with us that you'd had a bit of a bad interaction with somebody on the phone when you were booking a
Oh,
ride with
oh,
Mobility Plus.
right.
And then, yeah, we talked about it at the workshop and wanted to know what's changed. Yeah.
I had a very unpleasant call. And first, the man said to me, "What do you want?" And I said, I want to tell you that I want to book a ride for Wednesday, but it has to be on Tuesday this week. And then you'll be back next week to Wednesday. He said, "Wait a minute, slow down. Tell me why you want this." And I told him again, and he ended up by hanging up on me because he couldn't. He said, "I can't understand you," and hung up. And I started to cry and be very afraid to call for another time. And then when I went to the workshop, I found this same man there. And I said, I leaned over to Samantha and I said, should I say something or not? And she said, go for it. He needs to know. And so then I said, I needed to speak to your manager. And she was sitting right beside him. And she said, that's terrible. You shouldn't have been treated that way. And I heard through the grapevine that at another workshop I was at, that other people have had the same thing happen to them. And so after the workshop, they're as nice as anything. They're very conscientious about slowing down and saying what it is they want, and you get a chance to return. And it's changed since then.
Thank you for telling us that, Kathleen.
And,
It's so
Sam,
important to share. Yeah, Jim, go ahead, jump in.
And that company would not have known without hearing from the lived experience.
Exactly.
And that's why, or that's a great illustration of why projects need that different perspective.
100%. 100%. Okay, Jim, my next question for you. You've been doing work in this area for a really long amount of time. I think you told us 2011 yesterday. And I'm wondering, what improvements have you seen during that time in this kind of work?
I think more and more there is the recognition that projects benefit from having a person or people with lived experience on their projects. I think Laura, I think it was, talked about or emphasized that that I was involved, and Kathleen and others right from the beginning of this project, and it impacted the project all the way along. And it takes time for other researchers to really understand it, um, and experience why there is the benefit, why there is the need. And so I think gradually it's changing, but we still have have a ways to go. But you got people like Kathleen and me that don't stop talking.
Yep.
And we wouldn't have it any other way.
Yeah.
Laura, did you want to say something or before I ask this? Okay. Sorry. So, my last question for you, Kathleen. We're talking about the future, and we're talking about how do we build more dementia-capable communities. What's one thing that people, like people on this call, could make a difference for you in Waterloo?
I think to be more understanding, more compassionate, empathetic, and I think for me, for example, when I go to the library and I say, what would you suggest? I say, I only want 3 because that's all I can take in one time. And have someone come with me, not just say it's over there, but come with me because I don't always understand where I'm going. So I think that is one way. And to use my benches again, to have more benches. So anyway, yeah.
They're great starting points for us to think about. And Jim, my last question for you, formal question, we will have a Q&A, of course. But my question is, how do we expand from these sort of local initiatives or local plans to having this accessibility across Canada, especially in a country where we have these dense urban centers, but also suburbs and rural remote communities? How do we expand from the local to being more across Canada?
Good question, Sam. Yeah. Thanks very much. Bye. I I think that uh, knowledge translation, knowledge transfer, knowledge mobilization is one thing. Um, getting, um, you know, taking your action plan and and sending it out to various centers across the country. And, you may want to start small and send the link to within Ontario and not centering on government because that that requires a lot of time, a lot of people time in identifying who is the best person or who are the best people to send it to. But I'd be inclined to go, send it to the Chamber of Commerce. Chambers of Commerce are businesses, and chambers of commerce are advocates for business. And as I think we talked about and in Kathleen's video and so on. Yes, we talk about neighborhoods, but a lot of those neighborhoods are around businesses. And if the business themselves um, is not a part of the dementia capable community because of the sidewalks, because of whatever that has an impact, um, then they become a lot more aware of perhaps possibilities by reading this, or a lot more aware of if we did this as a community, i.e., government and so on, um, this would improve for all the residents. And that's where I think the impact can be is emphasizing um, emphasizing its relevance to business, emphasizing its relevance to communities, and emphasizing its relevance to government through the business groups. But that's just for this project. I think that that would be my route. So
Perfect. And that's a perfect way to end, Jim. This is an all community effort. It's government and businesses and community groups and
yeah,
community members.
yeah.
Oh, sorry, Kathleen, did you have one thing you wanted to add?
Yeah.
Mhm.
If, like, for instance, I discovered, I contacted the MPP, I guess is, I don't know what you call it, um, in Ottawa. Um, and she had figured out that yes, that was really a good thing, and she would work for us to get it not just all across the board. So she wanted to say, like, um, get get other, like,
Ministries,
yeah,
like other departments?
this
Yeah.
ministry
Mhm.
has this and this, and get it sorted throughout all of them. I'm not saying it right, but
You are.
yeah,
I think you're also adding, Kathleen, that in addition to all those people you just mentioned, getting politicians involved is also really important because they're the ones who
yeah,
represent us and make decisions about how things happen. So that
yeah.
concludes our formal presentation. We're now going to open up to questions, and I believe, Carrie, you are going to help us with questions from the audience, if I'm not mistaken. I can read it out. For the steering teams, how could seniors access Zoom calls? We have most who do not use technology or have the access. And then a second part of the question is, one area I'm curious about is how urban, suburban, and rural neighborhoods were assessed or differentiated. In my area in Hamilton, it can be challenging to differentiate between urban and suburban, where neighborhood characteristics frequently blend in our established inner city neighborhoods. Oh, shoot, those were two separate questions, and I read the whole thing. My apologies. Let's go back to how can seniors access Zoom calls, especially for those who do not use technology or have the access? Any of my panelist members want to respond?
I can start, though. I'm
Great.
sure Kathleen and Jim can add. So I think you're absolutely right, and we're increasingly trying to figure out ways to help older adults handle it. I will say, and I told Jim this story the other day, that my very first time being on a Zoom call was to meet with the Ontario Dementia Advisory Group or Ontario Dementia Advisory Group. So it was a group of people living with dementia, including Bill Highbine, who I saw on the list of the attendees, who had been meeting by Zoom regularly. I had never used it before. It was 2016, so no one was using it commonly, and I had to learn Zoom to integrate with them. So I think access to technology is a big issue. Access to internet is a big issue. Um, Meeting in person as well as online is important. But I think Zoom is a technology that when we have access to, iPads or computers, has been built to be relatively accessible. And I onboarded people to Zoom over the phone during the pandemic.
Oh, yeah.
For the first time because we had no other way of meeting people. So it's definitely a challenge. And I think, having those community centers and community groups are important, but it's a nice complement for people who really have a hard time getting through our communities. It's a complement, I think, to those in-person meetings, but something that I think we just keep working for improving accessibility. Absolutely.
And the second question about, oh, Jim, did you want to follow up?
I,
Apologies. I
I
saw
was
you
just
open your
going to
mouth.
say that the benefit of Zoom is the inclusion of different voices, that they don't have to be centered around the university. And when you have a project like this, for example, where you have urban, suburban, and rural, um, if you have a meeting where, let's say, all three groups are involved, then Zoom will sometimes be the the best or the only way of communicating with everyone. Um, but it is a matter of finding out how each person um, can adapt to it. Like having a one-on-one conversation. Will this work for you? How do I do Zoom? Um, I was co-PI on a project, and one of the research assistants would call some of the other members with dementia, and and walk them through getting
Yeah.
getting onto Zoom, and they would do that for every meeting, and that's what some of them needed. Others did not. So there are there are ways, and you just have to, in some ways, think creatively.
Absolutely. Kathleen.
And if you can also go to, say, a library and say, what do I do to get on to this Zoom call? Can you help me, please? I'm sure they would love to help.
A great idea. Thank you. And our second question is about how we assess or differentiate between urban, suburban, and rural. And since we have limited time left, I'll do quickly and say that we primarily use David Gordon, who's a urban planning professor at Queen's. He has a special way of figuring out neighborhood dissemination areas, which are a boundary within the that Statistics Canada uses, and trying to calculate neighborhoods based on travel mode share. So how do people primarily get around? And how we thought of it was that urban areas were more likely where people could walk to shops and stores less than 400 meters away. That's a quarter mile. Versus a suburban neighborhood where you have to get in a car to get to any of those shops, and then rural being in an area that's primarily agricultural. But of course, those lines are often blurred. And that was primarily how we differentiate between neighborhoods from walkable and urban to car dependent and suburban, classic suburban development, and then more rural areas within the region of Waterloo, places like Elmira and St. Jacobs, for instance. And I'm going to pass it back to Carrie, who's going to launch our final poll. But to sincerely thank you all for being here on behalf of all of us panelists and our fantastic research team and steering committee folks and folks who've been involved in all of the workshops, and to let you know that you can visit the website to see all the tools, and to please reach out if you are interested or have any questions. And let me know if I missed anything, team, before we pass it to Carrie.
Yeah, no,
Good.
I just think thank you to all the community members that have been involved in this project. It really was such a pleasure to have a group really dedicated to such an important initiative. And
Mhm.
echoing you to please reach out either through the RAA or directly to us if you have additional questions, because I know we only had a little bit of time there at the end.
Mhm.
Over
Yeah.
to Carrie, or sorry, Rachel.
Oh, I missed you, Rachel. All right, thanks everyone for attending. We do have a couple more questions for you just to understand your experience of the webinar. So I'm just going to launch that poll. It's quick 4 questions. If you could take a moment to fill those out, that would be great. I also wanted to let you know that we didn't get a chance to answer all of your questions, but we had such a great webinar today. So we will be answering those questions kind of offline and sending them to you afterwards via email. So keep an eye out for that and feel free to share that email again with um, all of your contacts and colleagues with whom you choose. We would also just like to say thank you today for also to our speakers and panelists for sharing your insight and expertise. I have placed the link to the Dementia Capable Communities website in the chat where you can access a lot of the resources that we spoke about today. If you have any additional questions or would like to connect directly with the Dementia Capable Community team, you can reach out directly using the contact information on this slide. So thank you again for your time and have a wonderful rest of your day.
Bye.
Thank you.
Bye. Oh,
Okay, I'm going to stop the recording now.
okay.